Hello, beautiful people. This video is an explanation of polyhydramniosis and what it is, its symptoms, its treatments, and what you can do about it. Polyhydramniosis is when there is too much amniotic fluid around the baby during pregnancy. The most common cause of polyhydramniosis are gestational diabetes, fetal anomalies with disturbed fetal swallowing of amniotic fluid, and fetal infections. Trisomy 18 is a fetal anomaly that is known to cause polyhydramniosis because babies have a higher risk of gastrointestinal and digestive issues. Therefore, they have issues swallowing the amniotic fluid, and that leaves an excess of fluid in the placenta. Because they aren't able to swallow the fluid adequately, it leads to the abundance of fluid once again, whether it be from, them not swallowing and a combination of the urine that they're outputting that's not being, recycled through and back out again. Polyhydramniosis causes slightly increased risk of pregnancy and birth complications. So I was induced at 37 weeks to prevent hemorrhaging and complications with the baby and high blood pressure and things of that nature. Symptoms of polyhydramniosis are shortness of breath, tingling feet, very mild swelling, and some uterine discomfort and Braxton Hicks contractions. Now, I experienced all of these in my third trimester. These are not all of these symptoms, but these are some of the main ones that I personally experienced. Some treatments for polyhydramniosis is drainage of the excess amniotic fluid. Your healthcare provider may use amniocentesis to drain the excess amniotic fluid from your uterus. That was suggested, but I declined it. I didn't want an amniocentesis to confirm the diagnosis, and I didn't want one for the polyhydramniosis either. Another treatment is medication. Your healthcare provider may prescribe oral medication. One is called Indocin or Indocin to help reduce fetal urine production and amniotic fluid volume. So these are just some of the symptoms, the complications, and the treatment, and an explanation of what polyhydramniosis is. It's something that's probably going to be inevitable if you have a confirmed diagnosis of trisomy 18 or a suspected diagnosis of trisomy 18. So, in essence, polyhydramniosis is just one of those things that you may face with a T18 pregnancy. So just be patient with yourself, be patient with your baby, and make the best decision for you. Thanks for listening.